We are in 103 batch. So we have a speaker today. Three of us will be speaking on. Our Dr. Nija will be speaking on a pre-treatment. And then Dr. And then Dr. Surangana will be speaking on OPU procedures. Yes, first speaker will be Dr. Nija.
Thank you. Hi, I'm Dr. Nija from Nepal, Dr. Nija Bhandari from Nepal. So I'm from 103 batch, C3 batch, and today I'm going to be talking about the pre-treatments before we start any IVF cycle. So we have to actually see the patient's protocol, what kind of a patient we are seeing, and accordingly what kind of adjuvant we need to add, we'll add accordingly. So if you have a patient with a POR, port ovarian reserve, then we need to do, what we need to do is we need to increase the androgen amount in our body. So how we can do that is by adding, either we add testosterone gel or we add DHEA. So these we need to start at least 2 months before the procedure. And if we have a patient and DHEA, we can give either 75 milligram per day or we can give 25 mg TDS 3 times a day. And second, if we have a patient with a PCOS, then for those kind of patients, metformin we need to add. And like sir said in our classes, metformin should be added at least 1 gram per day. And also there are like adjuvants like myoinositol and DCI, which are again new adjuvants that have come up with the pharmaceuticals companies have come up with. And the third one is the patient should be in a normal hypothyroid stage. So the thyroid level should be maintained between 0.1 to 2.5. If the patient is having any problem like 3 or 4, thyroid level, TSH level is more than 2.5, then in that case the thyroid medication should be started. And if the patient is having hyperprolactinemia, in that case also we should give cabergoline before the start of our IVF cycle.
Can I just interrupt? I want to tell you that first of all we have to treat
thyroid,
then
prolactin level will down.
Okay.
Okay, so if we have a patient, like I said, we talked about hypothyroidism, but if we have a patient who is having hyperthyroidism, then along with hyperthyroidism, hyperprolactinemia will also be there. So if we treat hyperthyroidism only, the prolactin level will come down. So in those cases, if it doesn't come down, then only we add cabergoline. Otherwise, with the treatment of hyperthyroidism, the prolactin level will also... Hypothyroid. Hypo will...
goes high,
The prolactin
will go high. Don't start treating prolactin.
Prolactin.
Hypothyroidism.
हाँ.
TSH को अगर हम कम
करेंगे
कम
हाँ.
ठीक
Yes sir, yes sir, I can. So and then again we can add adjuvants like vitamin D3 as well. And if a patient is having, if you already treated the patients and then you know that the patient is having thin endometrium, or you're thinking that the patient, like in PCOS patients, if you think that those patients will have thin endometrium, then in those cases you can add arginine from the very start, or you can do a withdrawal bleeding and then you start the cycle again. Thank you.
Thank you so much.